aspect about the roles of drug administration. And I think in your country, when you have some disease, you are coming to the hospital, and maybe not in the hospital, you just at home to treat the disease. You can, you will be given some drugs, and according to the different of administration. And maybe you have some wonder about why use this administration and why not use other administration. So let's explain why it. The reason. First, what means the route? The route of drug administration is the path by which a drug and the fluid and poison are taken to the body. So this called the route. The route. And I think you understand several administration routes, like some inhalation, some injection, some oral administration, like this one, is all belongs to the route. And from different route, the drug will enter into our bodies. So next I will explain why we choose them. The choice. If you not choose a appropriate route, maybe you will lose some action of a drug. And the different route of administration will have some effect on the speed and the efficiency with which the drug acts. Will decide the drug's action speed and the efficacy of drug action. I think you understand well. And here, let's compare. Give you a question. Compare the different speed of different administration route. One is inhalation from the respiratory system. Another one is oral administration from the enteral system. Which one will be faster? Okay, once again, two administrative routes. One is inhalation from respiratory system. Another one is oral administration from the enteral system. Which one will be faster? The drug effect will be faster or easy? Okay, the answer is inhalation. Because the drug will get into the respiratory system, the lung, the villi, and the villi is very close to the blood vessel. So will do the action very quickly. But for some oral, it will first enter into some stomach or maybe intestine, and then will first cross the membrane and then enter into the secretion. Maybe you first will get into the liver and then into secretion. So inhalation, no doubt, will be faster. It means when you were suffered the respiratory disease, you better choose the inhalation route to make the drug do the action faster. Okay, next one. Let's see types of the route. Two types. One is local administration. Another one is systemic administration. Systemic means the drug will finally enter into the circulation, but local, most of them will the drug cannot enter into circulation. So this is the difference. Into the blood or not into the blood. And into the blood means the drug can followed by the blood enter into the different tissue of our body. We call this administration is systemic administration. And systemic administration also have two branches. One is enteral and one is perienteral. Here, peri means bypass. Yeah. So enteral, no doubt. Yeah. This is a different system. Okay. This is about the different type. Next one, let's see the advantage and disadvantage about different route of drug administration. First one, local application. It means this route can only be used for localized lesions and at an accessible site and for drugs whose systemic absorption is minimal or absent. We just give a drug into the local lesions and will avoid the systemic absorption. We call this local application. And you can see like the skin. Yeah, when you have some disease on the skin, like some inflammation, like some lesions, you just use drugs to spread the lesions. Yeah, like some it's speculation, like some ointment, cream powder, and lotion paste. Another site is the mucous membrane, like the mouth. Yeah, like a mouse. If you also have some lesions, you can use some mouthwash and garlic to spread the drugs. And next site is the cavity. Yeah, like the severity and the psoriasis, like this one, to help this. And here is about the local application. And what's the advantage and the disadvantage of the local application? Let's see it. Advantage. First one, very fast, because it's the drug directly on the site of disease. Yeah, close connection. It touches that, so it will do its action very quick, fast onset of action. And next advantage is the better concentration, and because we know the site of disease, and we give drug, just give to the lesions, so it have very high concentration just on the lesion, on the disease. And the next one advantage is less quality is required. Just a little. Yeah, a little is enough. And last one is less systemic adverse drug effect reaction. Okay, less systemic, because the drug, most of drug cannot come into the circulation, so will take the minimal systemic ADR. This is about the advantage. And the disadvantage. The first disadvantage, not always possible to apply a drug locally. Yeah, because most of the disease is not the problem just on the surface of our body. Yeah, most of this not in here. The most disease will happen very deeply in our body. So you use local application, it cannot solve the problem. Okay, next one, it will take some local irritation. And last one, maybe it also will take some systemic toxicity. but it's very, I think very light, not so serious. Okay, this is a local application. Next one is systemic application. Yeah, I have said to you, it means the drug will enter into the secretion, the blood, and then will give this action on the whole body, include the therapeutic effect and the adverse effect. Yeah, when we need that, we call them therapeutic action, and when we not need this action, we call them adverse effect. It will have two subtypes. One is enteral and one is perienteral. Okay, let's see. It very give you a question. Which route is most safe about the following administration route? Oral inhalation, intramuscular administration, or sublingual administration? Which one you think is very safe to us, to our body? Yeah, very good. Very good. Most of you choose the oral. That's right. That's right. Because oral, when you take drug by the oral administration and you find some problem, you can eliminate the drug very easily. But if you give a drug by other administration route, it's very hard to eliminate the drug. So drug, I think is safe, most safe. So to our doctors, I suggest you, if you have no other noticed, you better give drug by oral because it's safe. It's safe. Now let's see the enteral administration. The first route is oral. Very common. The commonest mode. Advantage, very safe and convenient. Yeah, very convenient because everyone can do it. Like eating the drugs. Yeah, I think everyone can do it, and it's very easy to adjust the dose. You can give one pupil and also two pupils. That's very easy adjust that. But it also will take some disadvantage. See here. First one, the oral administration have slow onset and variable absorption. Yeah, because the drug will enter into body by some oral administration. It will pass the stomach, pass to the intestine, and to the livers, and finally will enter into the circulation. It's a long travel, right? And for some drugs, the dose we give the same dose, but from the oral administration, and finally enter into the circulation, it will have very long trip and will be metabolized by some enzyme. So the absorption is variable. Next one have some GI adverse effect, especially like some very strong acid and very strong the base. Yeah, make us cannot suffer it. Yeah, bear it. Okay, next one, not fit for the irrigant and unpalatable drug. I have said it. And maybe you can cover the drug with some palatable, the coat, maybe. You can solve the problem. Next one is not effect in the unconscious and uncooperated patient. If the patient have a coma, it cannot do this action. Okay, this is about the oral and some special preparations for the oral nutrition. We can use some special preparations to solve the disadvantage of oral nutrition. Like we can use some enteric coated tablet. This name, what means about this name? Enteric coated tablet. Yeah, it means the tablet, of course, the drug is in the tablet, well dissolved, not in the stomach, but in the intestine. We called enteric coated tablet because this tablet, the drug around the drug have a coat like the salicylic acid and the gluten like this one, and this material is resist the acid juice. Yeah, but permit disintegration in the intestinal. Yeah, resistor to the acid juice, but permit dissolved in the alkaline juice. So when we use these preparations, the drug will dissolved in the intestine, not in the stomach. So if we wanted to avoid the irritation of drug to our stomach, we can use these special preparations, enteric coated tablet. Next one is the sustained release preparations and the controlled release preparations. It's also around the drug have some special materials like some polymer and hydrophobic polymer matrix to coating the drug. And when the drug enter into the secretion, it will release very slowly, and keep the levels of drug concentration in the secretion very steady. Keep the steady levels. Like some disease, I think it like what? Like some hypertension and like some central nervous system disease. We need the drug keep a steady levels to help the function steady. So we use these two special preparations: sustained release preparations and controlled release preparations. Okay, next enteral route is sublingual. You can see sublingual, it means we give a drug under the tongue. And a very common example of drug by the sublingual administration is what? Is GTN, the glycyl trinitrate. When we give drug by the oral administration, most of drug will be eliminated. Will be destroyed by the stomach, by the intestine, and very little concentration enter into the secretion. But when we use GTM by the sublingual administration, most of them cannot be destroyed and enter into secretion to do its action. So sublingual, the advantage of sublingual, I think the most advantage is here. Very rapid onset and effective absorption. Because it will bypass what? First pass metabolism. Yeah, and why it? Because our lung have reached for blood vessel. Yeah, under our lung have very rich for the blood vessels. Yeah, micro blood vessels. So the drug will easily enter into the blood vessel directly and avoid the destroyed by the stomach or intestine. So it will get a rapid onset and effective absorption. Okay, it also have advantage that it is less enter into the GI tract. Yeah, gastrointestinal tract, and very useful in the vomiting and quick termination on spitting. And sublingual deposition also have disadvantage, like not suitable for irritant drugs. It's similar disadvantage like the oral deposition. And when drug have some bad smell and taste, it's not suitable for sublingual deposition. And here I want you to notice children. The child is not suited for sublingual administration. Why? Because they don't understand what means of sublingual. How to do it? Yeah, when you give a pupil, he just eat it like some oral nutrition. So I think no need. You cannot give a drug to the children by the sublingual administration. Okay, next one. The rectal administration. Yeah, we use some special preparations like some surveys to do it. And when we give drugs at the site, it maybe will be absorbed by two routes. One is from the upper rectal mucus, and another one is from the lower rectal mucus. You can see here, when the drug absorbed from the upper rectal mucus, it will enter into the superior hemorrhoidal vein and to the portal circulation. And the next target is liver. After metabolism by the liver, it finally will into the circulation. But when drug absorbed from the lower rectal mucus, it will enter into the middle and inferior hemorrhoidal vein, and finally to the systemic circulation directly. So if a drug be absorbed from this route, it will be destroyed partly by the liver and just part of drug entering circulation. And when the drug absorbed from the lower rectal mucosa, it can enter into the unconscious. Disadvantage: it have slow onset. Yeah, because have two pathway and have irregular and incomplete absorption. And I think for most people, they are unwilling to use this administration. Yeah, the rectal administration, because this pathway will make them embarrassing. embracing. Yeah, I think this is dirty. Maybe if you think it, and not suitable, not suitable. Okay, this is for rectal. Next root is perianteral. Compared to the anteral root, perianteral root means bypass beyond the GI tract. GI tract. Most of them is injection, and we have several advantages and several disadvantages. Advantage like the rapid action and accuracy dose, and suitable for some unwilling, unprofessor, and unconcise patient, and avoiding the drug modified by the GI tract or liver enzyme. But its advantage is inconvenient and life-safe, and maybe will cause some injury and costly. Okay, let's see it one by one. What kind of? First one is inhalation. Inhalation. And the preparations include the volatile liquids and the gases. This administration is very suitable for the disease in the respiratory system. Yeah, very suitable for the disease in the respiratory system. And have a good absorption, the excellent absorption. Why? Because the drug will first get into the lung and into the alveoli. And you know, our lung have very a huge amount of alveoli. So it have very wide surface area. And also because the gap between the alveoli and the blood vessel is very thin, so it will get a very good, very rapid speed. So let's see the advantage. Like the quick onset of action, and the dose required is very light, and the amount of drug given can be titrated. You can adjust the dose. And here the disadvantages it also will be attractive our interested. Like first one, because the drug will go to the circulation very close to our left side of heart, close to it. So it very easily produce the cardiac toxicity from lung, and a very short process, very short travel to our heart. So it will produce the cardiac toxicity. If you give a drug that has the cardiac toxicity, you need to notice the problem. It also will produce some local irritation, and will result in the increased respiratory secretion and bronch spasm. So the disadvantage of inhalation will produce the cardiac toxicity and the problem in the respiratory system. This is disadvantage, but very quick and have excellent absorption. Next one is nasal. Yeah, the drug will enter into secretion from the mucous membrane of the dose. Next one, very common, is injection. Here have some many injections. Injection means we use a sharp needle to penetrate our skin and enter into the blood vessel. Okay, let's see the types, like the ID, AC, IM, IV, and IP. I think most commonly is this one, IV. IV means what? means the intravenous. Yeah, it's very common. It's very common in the clinical. And if we will suffer a very serious disease and hope the action will happen very quickly, we use what? We use injection, especially the IV injection. IV injection. Okay, let's see it one by one. First one, intradermal. It's short for ID. The site of absorption is between the layers of skin. And when we give drug between the skins, we call it intradermal injection. Okay, it's a specific, but I think very little drug uses administration. Yeah, for some specific purpose, like some whitening and penicillin, the hypersensitivity test. Very nice. And why we use this theory? Because it's very painful, and we just give a small dose. Very painful. Why very painful? Because between the layer skin, it has reached for what? Nervous ending. Nervous ending. So it will induce the pain after the injection, the ID injection. Yeah, very painful. Next one is subcutaneous. Subcutaneous. So the site is under the skin. ID is between the skin, and the subcutaneous is under the skin. It also has reach for nerve endings and less vascular. So subcutaneous, the speed is not so fast, but painful. Next one is for some special forms of subcutaneous, like some gem jet and pilot implantation and salitic or biodegradable implants. Why we use implants? The very special forms. Why we use implants? Because when we use these special forms, it will increase the duration of drug. Yeah, very long. Maybe 1 week, and even were longer, up to 1 month. 1 month. So when you give it, you have a very long durations, and not use the drug very frequently, and decrease the times. So we use some special forms of subcutaneous. Okay, next injection is intramuscular. It means the site of nutrition is in the muscles, and muscle have less reach in the nervous line and more vascular, so it will have a very good speed. Yeah, very good on-site, fast on-site, and less painful feelings. This is intramuscular nutrition. And here the soul is the contradiction and complications. So let's compare the difference of these three administration: ID, SC, and IM. The difference is the administration site. You can see here ID between the layers of skin, and AC under the skin, and IM in the muscle. And which one do you think which route of nutrition is the most painful? According to my explanation, do you know which one is most painful? ID, SC, or IM? Painful. Yeah, give you a pain feelings. You can't bear it. Yes, very good. The answer is ID. Yeah, vascular vessel, the vessels. So this has some of a good absorption. Okay, have a rest 10 minutes, okay? Okay, come back. Please come back. Let's go. Yeah, I think if you are stout, you can do anything you like, but keep to see my slide after class, I think. Okay, next. Here we have introduced the parenteral route. It mostly refers to injection, and we have 3 injection introduction: the IDSC and IM. Next one, let's see a very common parenteral route. What's it? IV. Yeah, intravenous. Okay, let's see. IV injection, it also have different the description by different pathway. Like first one, a rapid IV bonus. Yeah, just one time. We give a drug solution into the syringe, and then to do the IV injection by only one time. Yeah, this is a rapid IV bonus. And maybe we can give the solution into the bottle, and then slowly inject it. And maybe we can give a solution into a big bottle, and from the vessels, and finally enter into our venous, like this one, a very large volume. So the speed of administration and the speed of traction is, this one is very rapid, and this one slower, and this one is even slower. Yeah, slowest. Because this depends on the purpose of administration. We just to give just one time and very quickly solve the problem, or maybe we give a large volume to make the drug concentration in our circulation more steady. study. Yeah, the different purpose will give our different decision on the IV injection. IV injection. Okay, this is intravenous. Venous. Now let's see the advantages and disadvantages of the intravenous administration. First one, you can see intravenous is very suitable for what? Emergencies. Like some coma, like some stroke, and like some cardiac arrest. Okay, this is very emergency. You can't not wait for the drug take a very slow action. So you choose what? You choose IV injection. Yeah, come on, very quick. No need to wait. We choose IV. And even maybe we can choose to the other administration like the cardiac injection. Maybe. Okay, next one. A very good absorption. The drug will enter into circulation up to 100%. It means all of volume will enter into the action. Yeah, no waste. No waste. It's very easy for the doctor to give the accuracy dose. Yeah, you want 50 mg the drug enter into circulation, you give the drug by IV. So it's very easier to do that. It's have an excellent absorption and have very quick onset, the immediate onset. And others like the hyplasm and urethral irritant, like that. It also have disadvantage. Let's see it. Like once you give the drug by the IV, the drug action can be dilated. Oh my God! You give the wrong drug, you give the wrong dose. It's a disaster. You know that? Yeah, very doubtful and very harmful. So if you decide give a drug by the IV route, you need very carefully. Yeah, give the accurate dose. And give the right drug. You know that? Yeah, because it's very hard to stop the action. Not like the oral administration. Okay, so I think this is very dangerous. And next, it will take some local irritation. Yeah, some inflammation, some venous inflammation. Even you give the right drug, give the right dose, but it also will do some lesion on the venous. You know that. Okay, next one. Extravasation and slotting may occur, and the next one, self-medication is very difficult. You cannot give the drug by intravenous at home. It better receive the drug in the hospital. So carefully use it. And when we understand the advantage and the disadvantage of different routes, we can decide what route can be chosen in different condition. So this is the purpose of why we must learn the advantages and the disadvantage of the administration. Now let's see this question. Which route will have more chance to produce cardiac toxicity? toxicity. You can see it. IV, IM, AC, or inhalation. Which one is correct answer? I have, yeah, yes, I have studied it. Yeah, very correct. All of you have correct answer. Inhalation. Because inhalation means the drug will give from the respiratory system, and the lungs, the villi of lung, very close to the blood vessel and very close to the heart, so will take a very harmful, very harmful, the insult to the heart. So inhalation will have the more chance to produce the cardiac toxicity. Okay, in this chapter, we have two aspects. One, I have give you some definition, some basic definition in pharmacology. At least you should master this one, pharmacology, the drug, pharmacokinetics, and pharmacodynamics. Next content is about the administrative route. I think there's no need to master all of them. No need to see that. Because it's very common in the hospital, and I think it's a basic knowledge to you how to choose the different route, different administrative route. How to choose that, like inhalation, like injection, the IV, IM, AC, how to choose them. And of course, the most safe is oral. If you have not so much the emergencies, I think it's better choose the oral nutrition and give the patient. Okay, this is chapter 1, introduction. Now let's see the next chapter. Let's see the next chapter. The pharmacokinetics. Okay, can you see a slide? Give me your reply. Oh, very good. Let's start. Pharmacokinetics. It belongs to pharmacology and very, very important branches. And now give me a very clear answer. What's the definition of pharmacokinetics? It includes so many content. And first, what's the definition? PK process means what? Do you have a clear definition? Yeah, we just learn it very soon. Okay, let's review. PK means what? Means what does what? Does the body to drug? Yeah, very good. I have seen it. I see it. Yeah, very good. Okay, now let's do it. PK, what the body does to the drug. It have two aspects. One is the movement of drug in the body. Another one is the alteration of drug by body. Yeah, it means how to a drug act on the drugs, how a body or act on the drugs, because we know the drug is exogenous substance, and when an exogenous substance enters in the body, our body will do some reaction on the exogenous substance, and this process we called PK process. Now let's see, it have four steps, four major steps. Pharmacokinetics include these four processes. You need to remember it very, very clearly. Let's see it. Absorption, distribution, metabolism, and accretion. Okay, which one belongs to the movement, and which one belongs to the alteration? Because here has four processes, and which one, or maybe which of those belongs to the movement, and which one belongs to alteration? Let's see. Absorption, come from the site of drug action and to the secretion, and distribution, the drug into secretion and then distributed to the bodies, the different tissues, and the metabolism, the drug structure will be changed by our bodies, and accretion, the drug from our body the drug out of our body. So which one is a movement and which one is alteration? Let's see. You can see movement include okay, wait a moment. Okay, the slide is okay. Okay, very good. I want to see it again because just you can see the first slide. Okay, now here PK have four processes. Let's see. PK have four processes. The absorption, distribution, metabolism, and the accretion. Have four processes. And this four process is the movement of the drug in body or the alteration of the drug by body. Light. Can you see the light? It's done. Okay. No. Come here. Come to see the slide. PK process have four steps. four process: absorption, distribution, metabolism, and accretion. And because let's see the differentiate. Absorption means the drug enter into our body, and distribution means the drug will from the secretion to different tissues, and accretion means the drug will out of the body. So these three processes belongs to the movement. Of drug in the body. And next one is alteration. Only one process, metabolism. Our body use some enzyme to metabolize the drug. So this is alteration. Okay, here I have some problem. Okay, wait for me to solve the problem. A moment. I just to open another live. Wait a moment.